there was a report last week in the Journal of the American Medical Association, which shows that the colorectal cancer is now the leading cause of death in adults younger than 50. And since 1990, overall cancer deaths are down, but colorectal cancer has risen every single year during that time period. And based on the fatalities and the study that was conducted, they tracked the fatalities of people of younger than 50 from 5 of the leading cancer-causing deaths over the past 3 decades. And that included lung/bronchus cancer, breast cancer, leukemia, brain and other nervous system cancers, as well as colorectal cancer. And they really aren't sure why this is the case, but if they had to point to a likely reason or reasons, it would be changes in diet, rising obesity rates, although that it has been on the decline in recent years with GLP-1 drugs like Ozempic that are helping with weight loss. But other factors that could contribute to colorectal cancer include sedentary lifestyles, alterations in the gut microbiome, as well as environmental exposures. These are all considered to be, at least they are likely contributing factors to colorectal cancer. And this is happening to several young and fit people who exercise, 5 times a week. They don't eat any soda. Some of them are vegetarians. They cut meat out from their diets completely, and they are still developing colorectal cancer and getting diagnosed with it. And one of the biggest problems when it comes to this is younger adults, these people who are seemingly healthy, they are getting diagnosed only after the fact, after the disease has progressed. And this reigns true in the diagnosis because 3 in 4 young adults who get diagnosed with colorectal cancer, they are diagnosed with an advanced case. And that could explain why the mortality rate is up despite these advances in medicine and treatment options. And one thing that doctors are recommending to young adults is to stay up to date with your screenings for colorectal cancer. And the general guidelines say that you should start to get your screenings at around 45. But if you are someone who has a family member with a history of colorectal cancer, or you have other risk factors that could potentially lead to it, they recommend getting it way earlier. And especially if you have a first-degree relative in your family who was diagnosed with colorectal cancer before the age of 50, they recommend that whatever age they were diagnosed with it, to get a screening 10 years earlier than the age they were when they were diagnosed. So for example, if a family member of yours was diagnosed with colorectal cancer at the age of 45, they generally recommend getting a screening starting at age 35 for yourself, just to be on the safe side of everything. And there are also 4 red flags to look out for when it comes to seeing if you might have colorectal cancer. And these include abdominal pain, rectal bleeding, diarrhea, iron deficiency, anemia. So if you are experiencing any of these or think you might be, it definitely can't hurt to at least go get screened just to make sure. You'd rather be safe than sorry